Support for Colorado Today comes from Safeway. Their pharmacists are here to help you and your family stay protected, offering a wide range of vaccines, including flu shots and COVID-19 boosters. Stop into the store or schedule online at safeway.com/pharmacy. Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org.
Your state lawmaker is headed back to the Capitol today. The governor called them all back to work for a special summer session so they can try to close a $1 billion gap in the state budget and to deal with a few other issues, including regulation for AI. We'll bring you updates in future episodes about what happens. And while they work all weekend at the Capitol, you can get fun ideas for your weekend a little later in the show. I'm Bazi Kanani. Coming up, backlash from layoffs at the city of Denver.
I don't know if they're really about trying to work on saving lives. I think for them it's more about the optics.
You'll hear what government functions are most affected with the job cuts that the mayor calls painful but necessary. Then there are changes to this year's rollout of fall vaccines.
And when it doesn't follow the process that health providers are used to, there's going to be confusion. That's going to trickle down to parents.
Find out the latest on the COVID vaccine. Plus, a trip to the opera and a leader's ideas to draw you in. It's Thursday, August 21st. Here's the news in Colorado today. Layoffs in Denver city government this week could be a sign of things to come for other cities.
Denver may be on the leading edge of, announcing fiscal challenges, but we are seeing it elsewhere, more at the state level.
Todd Ely is a public affairs professor at CU Denver. He's talking about how the state and many other local governments are having budget troubles right now. Denver announced its biggest layoff since the Great Recession in 2008. Denverite's Paolo Shalsita is here to fill us in on some details of how this could affect residents and who's been let go. Paolo, which parts of the city government are most affected?
The layoffs focus on what Denver Mayor Mike Johnston called internal-facing positions, with the cuts including city planners, housing and homelessness specialists, a spokesperson for the finance department, and scores of others. Among them is Carlone Manuel, who was the director of a resource hub for people dealing with addiction and homelessness for the past 2 years. Manuel said that with his termination, it appears to be the end of the center. He criticized the city for its decision and its apparent priorities.
I don't know if they're about saving lives. I think they're about looking at optics.
Other offices that took big hits include the city's climate office, the human rights office, and the Office of Children's Affairs. In addition to the 171 layoffs, a lot of these cuts come in the form of nearly 700 open positions being eliminated. Employees got notified Monday or Tuesday and stopped working the same day. Yesterday, Mayor Johnston called it painful but necessary.
Just how big is the city's budget problem, and how much could these layoffs help?
So Denver faces a $250 million budget deficit for 2025 and 2026. Now, post-layoffs, Denver still has another $100 million in cuts to make. They're targeting cuts to spending in city contracts, supply purchases, and services to balance the budget.
How did the mayor's office decide who would be let go?
So in previous cuts, there was safety in seniority, but not this time. The city used a new formula, which it said was designed to avoid targeting certain people. But some of the layoffs have generated claims that Johnston targeted political appointees or people he was unhappy with. Councilmember Stacey Gilmore's husband was let go from the Parks Department, and she claimed it was political retaliation.
He is a 61-year-old man that only wanted to serve out the last 4 years of his time till he was 65. And because of his sassy, loudmouthed wife, he got let go.
Yesterday, Johnston dismissed that claim pretty sharply.
Yeah, I think it's irresponsible and factually false.
He's also facing criticism now that his administration is building a fiscally irresponsible reputation by spending money on homelessness solutions and past waves of immigration. He responded by saying this budget is a sign of responsibility.
Are there city services that Denver has protected from the layoffs?
Yeah, there were no layoffs among police, sheriff's department, and fire staff, but those units still took on hiring freezes. The mayor also said the cuts will not result to changes in city services like trash pickup, facility operating hours, and permitting.
Are there any more layoffs still to come?
No. Yesterday, Johnson said the layoffs and furloughs among departments funded by the general fund are finished. However, Bazzi, what we'll have to wait and see is how well the city government will function without the jobs it terminated or froze. That's something we'll continue to report on.
Denverite's Paolo Shalsita. Thank you.
Of course.
If you have a question about vaccines for yourself and your family this fall, you're not alone.
I'm hearing a lot of confusion, both from parents and the public and also from providers.
David Higgins is a physician with Children's Hospital Colorado.
And that confusion comes from the fact that recommendations for respiratory vaccines like the COVID-19 vaccine this year have not been done in the normal choreographed process that we have for recommending respiratory vaccines every year.
Higgins and others spoke with CPR's John Daly to answer questions about vaccines just as the school year starts. John, what's the risk of the confusion Higgins is talking about there?
Well, confusion could affect a lot of people, including those who work to get vaccines to the places you'd want to get one. Normally, federal approvals happen on a normal schedule.
That allows manufacturers, insurers, and everyone to get on the same page and to get vaccines shipped to clinics and to pharmacies in time for people to get their vaccines before school starts.
The COVID vaccine is one that many are confused about right now. And we're in the midst of a new surge of COVID, so not great timing for that confusion. John, what is happening right now with COVID vaccine recommendations?
Okay, let's start with kids. Guidance from the CDC on COVID-19 vaccination in children has evolved. It previously recommended COVID shots for all healthy children aged 6 months and older under the new HHS Secretary, Robert F. Kennedy Jr., who, of course, has been a prominent vaccine critic. The CDC has kind of softened its stance. It now advises that for children ages 6 months to 17 years who are not moderately or severely immunocompromised, that the decision is left to the parents in consultation with their healthcare provider. And then just this week, parents got a new recommendation from a leading national doctors group, the American Academy of Pediatricians.
What are they saying?
They say kids 6 months through 23 months should get the COVID shot. That's because they're most vulnerable to becoming hospitalized. So that's an example where this key national group of pediatricians is going up against what RFK Jr. and his agency are saying. In meantime, Colorado health leaders will be deciding what recommendations to make for Coloradans.
If the feds don't recommend a vaccine, but the state of Colorado does, will insurance still cover that shot?
Well, just this spring, Colorado lawmakers passed a law to make sure that Coloradans will have vaccines covered by insurance companies, regardless of what the federal government does on that front. So I think the answer is we think so.
What about advice for adults and the COVID vaccine?
Well, the CDC recommends a coronavirus vaccine for most adults ages 18 and older, and they say that's especially important if you're 65 or older. But we're still waiting for the formulation of the shot itself. It's usually out by now, but it hasn't been approved yet, according to the Washington Post. I asked a pediatrician's office in Wheat Ridge about the impact of that. The clinic manager, Christy Parker, told me,
we're anticipating to get our flu vaccine shipment in the next week or two. However, COVID vaccines are still largely up in the air.
So there's question about the timing of delivery of the COVID vaccine. Will there be enough for people who want to get it?
I asked that question to the state's chief medical officer, Ned Kalange, and he says he does expect Colorado will have an adequate supply of COVID vaccines this fall. The Food and Drug Administration has signaled that it would not license upcoming coronavirus vaccines for otherwise healthy children, so stay tuned.
Are there other groups of patients who may be wondering what to do?
There's a disagreement between Colorado and the feds when it comes to the COVID vaccine for pregnant women. Colorado is continuing to recommend a vaccine during pregnancy, but the federal vaccine panel picked by RFK Jr. has been silent on that so far.
What about other common fall vaccines, the flu vaccine, the RSV vaccine? Are there disagreements about those recommendations?
No, I think the key thing to watch this fall will be what happens with the COVID-19 vaccines. And right now, you may be hearing more about COVID, seeing it in folks that you know. And you can see in Colorado's wastewater data that it's definitely on the uptick. And the West is the region that's listed as having the highest rate of COVID right now. So definitely worth knowing that.
CPR health reporter John Daly, thank you.
You bet.
Let's take a dramatic turn now to a dramatic art form. This is a famous tune from the opera La Traviata. It's known as the drinking song. Opera Colorado opens its new season this November with this Verdi classic about great love. And as the curtain lifts on the show, it will also have a new leader. Barbara Lynn Jameson recently started as general director and CEO of Opera Colorado. She hopes to draw in new audiences for opera through the season's productions, even though they're older works.
There's a fine balance of old and new because it really piques people's interest to see brand new opera. But what I think is really important is then when we put the older works up, that we also make sure that we're seeing them through a new lens, that they are not a plug and play. Those old works have survived so long because there's something universal about them. This is an adaptation of people on a stage reinventing the story for the moment they're living in.
Take La Traviata. The central character is a Parisian escort with wealthy clients who finds love, but class, family, and a secret stand in the way. Jameson envisions that heroine as a woman who tries to have agency in a society that tried to deny it. She also sees that in the lead female character in Madama Butterfly on Opera Colorado's lineup this season as well.
So we're looking actually not at two women who were in a society that didn't give them power. We're going to be looking at how they chose to give themselves some agency despite their societal situations. Those messages, when we bring those out in a piece of art like this, I think can reinvent.
The opera season starts in a couple of months. For this weekend, the annual State Fair in Pueblo starts. Also, in Fort Collins, you can participate in a costumed bike parade and festival at the Tour de Fat with New Belgium Brewery. And the Evergreen Arts Festival runs all day Saturday and Sunday. Thanks for listening to Colorado Today. This podcast is supported by listeners. Join the community and make your donation at the link in the show notes. I'm Bazi Kanani. This is CPR News.
Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org. Support for Colorado Today comes from Safeway. Their pharmacists are here to help you and your family stay protected, offering a wide range of vaccines, including flu shots and COVID-19 boosters. Stop into the store or schedule online at safeway.com/pharmacy.